Good afternoon, everyone. I'm Dr. Charita. My presentation is on incidence, risk factors, role of insulin like growth factor 1 and postnatal growth failure in ROP development in very low birth weight babies. As we all know, ROP is a multifactorial disease, the major risk factors being low birth weight and gestational age. However, local VEGF production and systemic IGF-1 levels play important roles. In preterm birth, there is a rapid fall in serum IGF-1 levels as maternal sources are lost, and there's an initial first phase of ROP where there's a decreased IGF-1 levels. But with increasing postmenstrual age and weight, systemic IGF-1 levels rise, permitting VEGF activity and leading to ROP. Studies in European and American cohorts have shown that low postnatal serum IGF-1 levels lead to severe ROP. However, IGF-1 levels cannot be estimated in all the babies. Therefore, postnatal weight gain can be used as a surrogate measure for serum IGF-1 levels. And there's limited research on the Indian cohort concerning these factors. The primary objective of our study was to estimate the incidence of ROP in babies with birth weight less than 1500 grams and to determine the perinatal risk factors. Also to determine the role of insulin like growth factor 1 and postnatal growth failure in predicting ROP. Sample size was estimated to be 329. It was a prospective cohort study conducted in the departments of ophthalmology and neonatology in JIPMER after IEC approval. The inclusion criteria was birth weight less than 1500 grams and preterm babies less than 34 weeks of gestation. Babies were divided into two categories, ROP versus no ROP, and further classified for intergroup comparison as group 1 no ROP, group 2 mild ROP, group 3A moderate, and group 3B severe and treatment requiring ROP. Weekly birth weight was estimated and monitored using growth charts. Growth failure was diagnosed based on Z-score. 1 ml of blood was collected for IGF-1 levels, centrifuged and deep freezed and assessed in ELISA kits. So Z-score was calculated at birth and at 36 weeks, and the difference in Z-score, if it was more than 0.8, so if there was a fall of more than 0.8, it was considered as postnatal growth failure. Results: the incidence of ROP was 49.5% in our study, mild ROP 44.4% and moderate severe ROP 5.1%. Mild ROP had 146 babies, whereas moderate severe ROP had only 17 babies. On univariate analysis, gestational age, birth weight, low weight gain per week, postnatal growth failure, insulin like growth factor 1 levels, oxygen supplementation, antenatal steroids, small for gestational age, respiratory distress syndrome, low APGAR score, and mechanical ventilation showed statistical significance. The gestational age followed non-normal distribution. The data, most of the babies belong to 32 to 34 weeks of gestational age, and the median gestational age for babies without ROP was 32, whereas it was 30 for babies with any stage ROP. And birth weight distribution, around 52 babies were extremely low birth weight, and the group with babies having any stage ROP had a lower median birth weight of 1100 grams compared to the group without ROP. It had 1230 grams. And the babies with any stage ROP had a lower median weekly weight gain compared to the babies with no ROP. The weight gain was 91.6 grams per week in any stage ROP group. And IGF-1 levels, it was estimated only for around 186 babies due to logistic and medical reasons. And also the median IGF-1 levels were lower in the babies with any stage ROP, 18.82 nanogram per ml, compared to no ROP group with a median value of 28.8 nanogram per ml. Postnatal growth failure was found to be more in the babies with ROP. On multiple logistic regression, only serum IGF-1 levels showed significance. And area under the curve for IGF-1 levels was 0.627 with a cutoff of 25.56 nanogram per ml, indicating it to be a fair indicator for predicting ROP. And the area under the curve for weight gain per week was 0.621 with a cutoff of 107 grams per week. Discussion: there are various studies, previous studies comparing IGF-1 levels, and our studies had similar values, and it's one of the first study in India to estimate serum IGF-1 levels with the largest sample size of 186 babies. And weight gain per week values also were comparable with previous studies with a cutoff of 107 gram per week. Limitations: collection of 1 ml blood for IGF-1 estimation was difficult, so we had missing data. So along with the established risk factors, lower weight gain per week, postnatal growth failure, insulin like growth factor 1 levels were the additional important risk factors analyzed and noted to have association with ROP. Our study analyzed 186 babies for IGF-1 levels, one of the largest sample size and first in India, with a cutoff of 25.56. However, future studies establishing prediction models with these is required. Thank you.
I've got just one suggestion. You are putting from stage 1 to 5 together. So stage 1, the ROP grading is less, so their weight will be more. So you should have 5 categories and then you should compare. Instead of, from 1 to 5 together you're comparing. Stage 1, how many children had a birth weight high? Stage 2, definitely stage 5 children will have a less birth weight.
Actually, we do not have any stage 4 or stage 5.
You don't have
babies.
at all?
Like in this only up to stage 3.
Why?
Babies. We, like in the screening, ma'am.